Located in Milwaukee, Wisconsin, L&R USA Inc. is part of a global medical device and supplies company with a 160-year history of designing and manufacturing innovative compression therapy and advanced wound care products. Living with lymphedema presents many challenges. At L&R USA, our goal is to enable patients to maintain a full and active lifestyle.
You come through cancer treatment and you want to just be normal again. And then to be told that you have a chronic condition that you're going to have to manage for the rest of your life, it made me angry. I would go to work, I had children to take care of in the evening. By the end of the day, I was so tired that to try and wrap became very challenging because I was already so tired.
What sets apart the Tribute from other items is the design, the actual makeup of the garment, but also the ease in donning and doffing. When we think about quality of life and making life easier, this definitely does.
And so to be able to put on a Tribute garment in about 5 seconds and be ready for bed was really beneficial.
I've been a practicing therapist for 22 years. I think one of the biggest compliments a patient can give is that they can't wait to put their compression on at night because it feels so good.
Much more comfortable, honestly, to have a garment that's actually fitted for your leg and that you can move around in. Even if you had to get up in the middle of the night, I can leave those on because it's custom to you and you're different from everyone else.
As part of our commitment to provide the best possible compression therapy solutions, we have prepared this video demonstrating the measuring guidelines for L&R's TributeNight custom therapeutic nightwear compression garments, part of the Solaris collection of garments and wraps by L&R. All TributeNight garments are custom designed and fabricated for style and donning preferences. The measuring positions indicated on the order forms are for reference only. Use your professional judgment. The most appropriate measuring locations will vary depending on your patient's presentation. As you take each measurement, record it in the appropriate space on the order form as shown. And remember, all measurements are taken in centimeters. Since TributeNight garments are most commonly worn while the patient is sleeping, we recommend measurements be taken in a supine position. If necessary, measurements can be taken in standing or seated positions, but always indicate on the order form the position in which the measurements were taken. In extreme presentations, measure the lobules, breast, or pannus in a supported position. Note that when skin folds are present, measure the largest girth. Additionally, you may measure the circumference under the skin fold. If there is girth fluctuation, indicate the girth range on the form as shown. With the patient in a supine position and their arm lying next to the trunk, begin by marking the length of the arm. If needed, place a pencil or dowel in the armpit as a visual guide. You will use these marks later as a reference when measuring circumferences. With the palm up, measure from the digit crease, MCP, to the fingertip on the third digit, or middle finger, and record on the order form. Again with the palm up, measure from the digit crease of the third digit to the wrist crease, or determined 0 position, and record as B length. An additional measurement can be taken from the wrist crease, or 0 position, to the first digit web space, and record. Measure from the determined C position, or 0, to the largest circumference of the forearm, or determined D length, and record. With the elbow in slight 10 to 20 degree flexion, measure from the determined 0 position, C, to the medial elbow crease, or the determined E position, and record. Measure from the determined 0 position, C, to the largest circumference point of the upper arm, or determined F position, and record as F length. Measure from the determined 0 position, C, to the axilla, or determined G position, and record as G length. Determine the position of the acromioclavicular joint and mark. Then measure from lateral G length to the determined H position and record. Determine the position of the HPS or high point shoulder and mark. Then measure the I length from the acromioclavicular joint to the HPS or base of neck and record. Now measure and record circumferences at the determined positions with the patient in a relaxed position. As an optional A measurement, measure the distal circumference of the hand in a relaxed position and record on the order form as shown. Next, measure the palm circumference across the metacarpal heads, or the determined B position, and record. To determine the C circumference, measure the wrist circumference over the styloids or at the determined 0 position and record. Measure the circumference of the forearm at the determined D position and record on the order form. With the elbow in a slight 10 to 20 degree flexion, measure the circumference of the elbow at the determined E position. Use the medial elbow crease and mid-olecranon process as your reference points. Record as shown. Next, measure the circumference of the upper arm at the determined F position and record your measurement on the order form. The G circumference is measured at the axilla or determined G position. Record your measurement on the form as shown. Now with the patient seated, measure the diagonal circumference, beginning at the anterior acromioclavicular joint to the opposing axilla, back to the posterior acromioclavicular joint, and record your measurement on the form. Your measurements are now complete. Next, you can choose to customize your garment further with modifications and design. The TributeNight hand order forms are right and left specific. Position your patient's hand on a copy of the order form, aligning the wrist crease on the 0 position. Trace around the patient's hand with a pen or pencil, keeping the tip as close as possible to the digits and hand. As an optional A measurement, measure the distal circumference of the hand in a relaxed position. Indicate the total length by marking a line at the top of the hand on the order form. Measure the palm circumference across the metacarpal heads or to the determined B position. Record your measurement and indicate on the form where the B circumference was taken. Measure the wrist circumference over the styloid or determined 0 position and record on the order form. Measure the proximal circumference of the first digit or thumb and record as D on the order form. Measure the proximal circumference of the second digit, or index finger, and record as E. Measure the proximal circumference of the third digit, or middle finger, and record as F. Measure the proximal circumference of the fourth digit, or ring finger, and record as G. Finally, measure the proximal circumference of the fifth digit, or small finger, and record as H on the order form. Your measurements are now complete. Next, you can choose to customize your garment further with modifications and design. With the patient in a supine position and legs adducted in a natural relaxed posture, begin by marking all length reference points on the lateral leg. You will use these marks later as a reference when measuring circumferences. Place a pencil or dowel at the groin and have the patient hold a tape measure as a visual guide if needed. A length is measured from the heel, indicated on the diagram as 0, to the determined distal position. If you'd like full foot coverage, measure to the tip of the great toe. Record your measurement on the order form. B length is measured from the heel, 0 position, to the determined B position on the lateral side of the leg, which is typically the largest girth point of the ankle. Measure the C length from the 0 heel position to the determined C position, which is typically the largest girth point on the calf. D length is measured from the 0 heel position to the determined D position just below the patella. Measure E length from the 0 heel position to the mid-patella or determined E position and record. F length is measured from the 0 heel position to the determined F position, the largest girth point of the thigh, and record. To determine the lateral leg length, measure from the 0 heel position to the determined G position and record. To determine the medial leg length, have the patient hold the tape measure at the groin on the medial side of the leg and measure to heel or 0 position. Record on the form as mg length. H length is measured from the 0 heel position to the iliac crest. Record the determined H length. For garments ending at the I position, measure from the 0 heel position to the natural waistline. Record on the form as shown. For J-length garments, consider crossing the transverse plane or watershed, or you can customize the J-length to meet your patient's needs. To determine the AS length, have your patient hold the tape measure and measure from the mid-crotch to the anterior natural waist. Record your measurement. With the patient continuing to hold the tape measure, determine the PS length by measuring from the mid-crotch to the posterior natural waist. Record your measurement. Now with the patient again in a supine position with legs adducted in a natural relaxed posture, measure circumferences at the positions you marked previously. To determine A circumference, measure the circumference of the foot across the MTPs and record. Measure the circumference of the ankle at the determined B position and record. Measure the Y circumference diagonally from the 0 heel position over the anterior foot back to the posterior heel. Measure the C circumference of the calf at the marked C position. Measure the D circumference at the marked D position just below the patella. Measure the circumference at the marked E position or mid-patella and record. To determine F circumference, measure at the marked F position on the upper leg. Measure the G circumference straight across at the level of the groin, being careful not to angle the tape measure on the lateral side of the thigh. Measure the H circumference across the hips at the marked H position, which is usually across the iliac crest or the largest point of the hip. Record your measurement. The I circumference is measured at the natural waistline or the determined I position. Record your measurement on the form as shown. Finally, measure the J circumference at the determined J position and record your measurement on the order form. Your measurements are now complete. Next, you can choose to customize your garment further with modifications and design. Begin by marking length reference points on the patient's lateral torso and shoulder. You will use these marks later when measuring circumferences. The patient's natural waistline is designated as 0 on the order form. We recommend upper torso garments extend below the transverse watershed, approximately 5 centimeters below the waist at the determined H position. Take the corresponding H circumference measurement and record as shown. Then, positioning the tape measure at the waistline or determined 0 I position, measure to just below the breast or determined J position and record this measurement. Continue to measure from the I position to the mid-breast, the fullest part of the breast line, and record your measurement. Continue to measure from the determined I to the L position at the level of the axilla and record your measurement. To determine the shoulder width, or M length, measure from the HPS, high point shoulder, or base of the neck, to the acromioclavicular joint. The N length is taken with the patient holding the tape measure at the determined I position or waistline. Measure from the midline anterior waist over the shoulder to the midline posterior waist. Record the measurement on the form as shown. For the O-length or armhole, measure from the acromioclavicular joint under the axilla and back to the starting acromioclavicular joint 360 degrees. Now, using the marks you've made as reference points, measure and record circumferences. To determine the eye circumference, measure the circumference at the determined I or 0 position and record on the order form. Measure the circumference at the determined J position, lifting the breast if necessary. Record your measurement on the order form as shown. Measure the circumference at the determined K position and record this K circumference on the order form. For unilateral mastectomy, measure the left and right side independently from anterior midline to spine. Use the comment section on the bottom of the order form to record unilateral measurements. Finally, measure the L circumference above breasts at the determined L position and record. Your measurements are now complete. Next, you can choose to customize your garment further with modifications and design. For the A measurement of the face, measure over the top of the head from the left superior ear crease to the right superior ear crease. Record your measurement on the order form as shown. Take the B measurement of the head by encompassing the forehead, temple, and back of the head. Record the measurement. The C measurement is taken horizontally from the outer crease of the right eye to the outer crease of the left eye. Record your measurement on the order form as shown. D is measured from the bridge of the nose to the tip of the nose. Record this measurement. E is measured from the base of the nose to the upper lip. Record on the order form. The F measurement is taken from the base of the lower lip to the tip of the chin. Record this measurement on the order form. With the chin in a relaxed position, take the G measurement from the sternoclavicular notch to the chin following the contour of the neck. Record your measurement on the order form as shown. The H measurement is taken horizontally from the right earlobe crease to the right nostril crease. The I measurement is taken horizontally from the right earlobe crease to the right nostril crease. Record your measurement on the order form as shown. For J, measure the distance from the right TMJ to the midpoint of the chin, following the mandibular contour, and record. Again, following the mandibular contour, measure the distance from the left TMJ to the midpoint of the chin, and record as K on the order form. For L, measure the length from the right earlobe to the HPS, or high point of shoulder, and record. To determine M, measure the length from the left earlobe to the HPS, or high point of shoulder, and record. Finally, measure the neck circumference at its greatest girth, and record the N measurement on the order form. Your measurements are now complete. Next, you can choose to customize your garment further with modifications and design.
From a therapist perspective, the support that I receive from L&R, the knowledge in measuring, the support that if maybe there's an issue or something isn't quite right, they always make it right. When you can get that garment to fit to the point of a patient saying, "I can't wait to put it back on," that's a very good garment.
It's made my life with lymphedema so much easier.
At L&R, we are committed to helping your patients receive the full benefit from their 100% custom TributeNight garment. We hope this video has provided a user-friendly guideline for measuring with L&R's forms. Should you have any questions regarding a custom design or selecting a style of compression garment for your patient's individual therapeutic needs, our Design Center team is ready to help and available by phone, email, or video conferencing. Thank you for your continued business and for choosing L&R USA Inc.